Welcome to the College of the Redwoods Nurse 20 lecture on clinical reasoning and thinking. This lecture will be recorded in two parts, so please be sure and listen to both of those parts. You will find the reading material that accompanies this lecture in Module 36 of your textbooks, titled Clinical Decision Making. Let's get started. Adult learning. What is it about adult learners? Well, they're self-motivated. You're goal-directed. You find learning both meaningful and practical. You're very participatory and interactive, and you want to know what you're doing and why you're doing it. The rationales are important to us as nurses. You're engaged. We, as your faculty, have taken an educational focus that helps to develop your critical thinking and your clinical decision-making skills. This is the reason that we use programs such as ATI. We look at your objectives for learning in terms of Bloom's taxonomy. We'll talk a little bit more about that in a few slides, but that focuses on the domains and the levels of learning. We go from basic knowledge up to being able to assimilate and then even transfer knowledge. We also use the nursing process, the assessment, diagnosis, planning, implementation, and evaluation process that we have talked about in the past. When we look at critical thinking, what is it? Well, it's purposeful, self-regulatory judgment which results in the interpretation, analysis, evaluation, and inference, as well as explanation of the evidential, conceptual, methodological, criteriological, or contextual consideration upon which judgment is based. Vassione gave us that definition in 1990. But what is really critical thinking all about? Well, you've been doing it, and we've already asked you to do even more of it. After you leave this course and you go to N3 and N4, you will have your critical thinking caps on all the time. Critical thinking skills that you currently use, whether you're a licensed vocational nurse or a paramedic, include interpretation. You look to understand and explain. As you develop your skill as a registered nurse, you'll find that you will do more analysis, correlating things that you'll see in the clinical environment, identifying consequences, developing that best plan of action. As you evaluate, you'll assess the evidence and you'll learn about evidence-based practices. You'll want to participate in evidence-based practices because you'll know, as a registered nurse, those are the ones that will provide your patients with the best outcomes. You will use inference to draw conclusions based on the evidence. That will include both inductive and deductive reasoning. You will understand that for every action, we have a rationale. We need to be able to give an explanation for what we do. And as you move along through your career, you will self-regulate. Self-regulation is where you question and monitor your own thinking. When we look at Bloom's taxonomy includes levels of learning as well as levels of thinking. It's our cognitive skills, our affective, and our psychomotor. We use them in all of the areas that we function. So we have knowledge, and upon that knowledge, we start to understand. Knowledge for the sake of knowledge is trivia, right? Recalling facts is important only when we can use those facts for something meaningful. So we start to comprehend, we understand, and then we are able to use that knowledge in new situations. We apply the knowledge. Later, we develop the skill of breaking things down using critical thinking and analyzing. Why did this particular process work with one patient but didn't work with another? We start to put things together through critical thinking and synthesize. We'll talk a little bit more about this towards the end of the lecture, but what happens when we start to have experience? We learn then the value of judgment and how to use good clinical judgment. When we are looking at test questions, we want to think about some of the key words. And why am I asking about test questions? Or why am I talking about test questions? Well, a couple of reasons. First of all, this is your first course in your bridge from becoming either an LVN or paramedic to a registered nurse. So these key words are things that you will start to think about without realizing that you're using the words. And the way we assess your thinking about those things is when we see you use them in a test question. So you might hear me say sometimes, you're a nurse. There's always something you can do first. Before you call the doctor, there's always something you can do, or the provider. So what nursing intervention would the nurse use initially? What nursing diagnosis would have the highest priority? Or what intervention would have the highest priority? What sign and symptom is the most important? Right? So this is where you sometimes will hear maybe the paramedic says, oh, it's always airway, most important, right? Well, I don't know. If I have a bleeding femoral artery, airway is not at the top of my list. So it's usually, but we have to look at the big picture. Which of the following best demonstrates? Which of the following is an early sign? This is one that's usually pretty easy for the paramedic that's transitioning to the RN because they see the early signs. They pick up the early sign at the ambulance, and that's what they're taking to the hospital or the long-term, wherever they're taking them, whatever level of care they're taking them to. But this is a little bit harder for the LVN. They see the later signs because they typically take care of stable patients. So we all have challenges with these key words in test questions because we tend to see what it is that we have learned to practice with in our earlier career skill set. So practicing looking at these keywords in test questions helps your critical thinking. When we help develop critical thinking, we then develop clinical decision-making and clinical reasoning. Critical thinking skills that you will use in nursing include analyzing, applying standards, discriminating between sets of data, information seeking. You may need to find more information, and using logical reasoning to predict and then transform that knowledge into something that you can use. How do these fit together? With critical thinking at the center, when we look at being able to use our nursing skills, we have to have decision-making, problem-solving, clinical judgment, and creativity all coming together in order for our patients to have good outcomes. You'll see that there are some ordinary skills that we all have. We make a guess. It's a best guess. We prefer a particular method or a particular way. We group. We believe. Sometimes we believe even in spite of the facts. So it's very important for us as nurses to be sure that we are open-minded, that we continue to look for new information. We start to infer and make associations. Sometimes we have to suppose, and sometimes we have to form an opinion. We want to judge using criteria, but sometimes we have to make a judgment without criteria. When we look at higher level thinking, we're looking at things like estimating, and we estimate based on exemplars that we have experienced. So we will gather data, we start to evaluate and classify those things in our mind and put them into categories in our memory banks. We will start to make assumptions, logically inferring as opposed to just inferring. We will grasp principles that will help us to transfer knowledge from things that we learn through our experience about one patient and be able to use that when applying with a different patient. We'll want to hypothesize, and we'll start to understand, and not just understand, but develop rationales that will help us to be participants in contributing to the overall body of nursing knowledge. And we will judge with criteria. So you'll remember that we had critical thinking in our diagram as well as creative thinking. So critical thinking is reasoned, it's reflective, it's very focused, and it's dynamic. Whereas our creative thinking is a way that we practice thinking out of the box. We sometimes brainstorm. We might make a list of pros and cons or imagination. We think, if I were in a perfect nursing world. Creative thinking has helped many nurses many times to solve problems that otherwise would not have had good outcomes for our patients or good solutions. We also include this problem-solving method where we start initially by trial and error, but as you learn and as you use exemplars, you will start to have that art of nursing that you've heard me talk about. We have the science with our nursing process, but you'll start to get an intuition that tells you there is something wrong, or maybe there's something very right. You will use all of that in your problem-solving skills. You'll start to be very good at decision making. Right now, it might seem a little bit frightening to have some of the higher level decisions put into your lap, right? You have to make a choice, but understand that decision making is a process. If we use our critical thinking and we use our creative thinking, along with our knowledge, as well as our exemplars from the past, we have a set of criteria that we'll look at and develop alternatives. We will also start to troubleshoot and ask, what if? The what ifs are the ones we have to be careful with when we're doing our test questions, though. What are the characteristics of that critical thinker? Well, we have to be open-minded. We need to be flexible, always looking for questions and answers, very inquisitive. Sometimes we just have to think about, I don't really know what the question I need to ask is, but I know that there's something that's just not right. That's where it's important for us to think creatively and be self-directed in seeking out those experts that will help us as we become better nurses. And self-reflection or reflecting on the situation are also key characteristics of the critical thinker. At this point, I'm going to stop this audio lecture. This will be the continuation of the same PowerPoint, but I'll see you back here in just a few minutes.